So fortunate to have him come talk today. We'll turn the meeting over. Kris.
Thank you all for coming. Most importantly, to all of our patients, thank you very much for taking an extra hour to listen to us yet again. For those of you that are not involved with Chippenham's Pulmonary Rehab, my name is Kris Beshada and my coworker is Christina Hunt. What we decided to do so that we didn't repeat too much information that all of you have heard before, I'm going to give you a brief overview about pulmonary rehab. I have made some handouts for all of our patients. If you would like one of the handouts, ask us in rehab. I made 12 copies. After I finish, Christina is going to touch base on some very important questions that all of you have in regards to oxygen use. First and foremost, the main question that we hear on a daily basis: will I become addicted to oxygen if I use it? So please try to stay. I'm going to try to make mine short and sweet, as I know many of you are familiar with pulmonary rehab. There are 4 or 5 pulmonary rehabs in the city. We are considered an outpatient pulmonary rehab program. We are coordinated with our sister hospital at Johnston Willis. We are a physician-based program, meaning your doctor needs to refer you to our outpatient program. There are other very good pulmonary rehabs throughout the city. One that is comprehensive in that it is inpatient as well as outpatient is Health South, the Rehab Hospital of Virginia. That is located on Fitzhugh Avenue, right down from St. Mary's. Henrico Doctors has an outpatient pulmonary rehab, and then in South Richmond, John Randolph has a pulmonary rehab. What is your criteria for choosing a pulmonary rehab? Honestly, first and foremost, it is physician referral. Second, what is convenient to you based on location? For many of you, and I know this does not fall in deaf ears, waking up any given day, you're not really sure how you're going to feel with your breathing. The last 4 or 5 days of rain have made it very challenging just doing day-to-day activities at home. Getting up and out 2 to 3 times a week to come into exercise at any pulmonary rehab in the city requires a great deal of energy and a huge commitment on your part. That's why Christina and I stress make it convenient. When we receive referrals, we would love to be able to get the referrals in the very next day. What we are trying to do is hopefully get them in within 3 to 4 weeks of the referral. What I'd like to do right now is actually read you the medical definition for pulmonary rehab. Pulmonary rehab is a comprehensive intervention for patients with chronic lung disease who are symptomatic and who often have difficulties with activities of daily living. It is designed to reduce symptoms, optimize functional status, increase participation in daily activities, and reduce healthcare costs by stabilizing and maintaining the disease process. The last few words of that definition is the most important for all of you to hear, and quite possibly the most difficult for Christina and I to share with all of you during an assessment. And that is, we cannot, in pulmonary rehab, reverse your disease process. Very difficult thing to say. However, we can help you maintain. We can help you find the information you need in staying well, and most importantly, what we did not pay Mr. Jenkins to say, but what is very, very true, we can care for you, but our patients have a wonderful time where they're doing it. I will tell all of our patients when they come in to find out about pulmonary rehab, I admire your commitment to do the most difficult part of your day, and that is to be more active in order to increase your strength and endurance and to learn how to manage your level of breathlessness. How do you learn to manage your level of breathlessness? Quite honestly, Christina and I will tell you during your initial assessment or possibly when you first call to set up your appointment. We are actually going to instruct you in an easier way to breathe. How many of you in doing your day-to-day activities find that just getting up and bending down to pick something up, or even sitting in your chair and bending down to pick something up, makes you extremely short of breath? I use pursed-lip breathing to help in a very stressful situation, because for me, stress just causes the entire body to become very, very tense. For all of you in doing your day-to-day activities, shortness of breath is increased with simple activity. So Christina and I will go over when our patients feel the increase in breathlessness. We will also then instruct our patients in a very easy breathing technique called pursed-lip breathing. I'd like to review that for all of you that are not familiar with it. Pursed-lip breathing, you breathe comfortably in through your nose, pucker up slightly like you're blowing out birthday candles, and you blow out twice as long as breathing in. It is intended to assist your airways so that when you go to take a deep breath in, there is room for the oxygen to get into the airways, transfer into the bloodstream, and get to the muscle groups in order for the muscles to be able to function properly. That is the piece that is important in pulmonary rehab. How do we get you to be able to exercise comfortably when you recognize how difficult it is to do your day-to-day activities? Showering and bathing often makes our patients very short of breath. Trying to get to the grocery store, buy just groceries that you need, get the groceries in your car, drive home, get the groceries out of your car, get in the house, put your groceries away. All of that is very necessary for your well-being. However, all of that requires a great deal of energy and effort and will increase your level of breathlessness. Pulmonary rehab is intended to increase that strength and endurance. We offer education on medication. One of our patients who's not able to be here today, Teresa Dreyer, she has a wealth of great information, but the one thing that Teresa will do is Teresa will share with us what she has found that she feels others would benefit from in regards to education with having a breathing problem. Teresa brought up a very good point, and I said, Teresa, I'm going to mention that at the meeting, and that is a challenge to all of you to please stay current with the information that's available to you either online, through support groups, through what the folks in the back of Anthem have offered. Investigate, check it out. It's very, very important that you are very comfortable with the care you are receiving. Make sure that you are taking all of your medicines correctly. When we're in the doctor's office, we are given our medications, and if you're like I am, yes, I understand that. And I get home, and I think, now what did he say? Don't be afraid to call back and ask, what is the correct way to use this? Don't be afraid to ask questions of your pharmacist. Am I taking my medications correctly? Am I taking the combination of medications that have been prescribed for me at the right times of day? Is my inhaler technique correct? That is one of the first things that we all can become lazy with, for lack of a better term. It is not something that we intend to do incorrectly, but we get very comfortable with how we do things, and we're not even aware that we are maximizing the full benefit of the medicine simply by having correct technique. If you have a doctor's office visit, and I know that it can go very quickly, and sometimes it is never intended for your doctor's visit or your pulmonary rehab visit to go too quickly, but if you're not sure how you're taking your inhalers, sit down and ask the doctor, can I go over my technique with you? They would be thrilled to ensure that you're using your medication correctly. Warning signs of infection is another hot topic with the education piece in pulmonary rehab. And bravo to all of you, and thank you to all of you who are giving the vaccines. Very important to stay current with all of your vaccines. Flu shots, especially October, November. Pneumonia vaccines, based on the recommendation of your doctor. Stay current with that. Russell?
Have we got anybody else wants a flu shot? Get in line. Sorry.
Oh, no, that's okay. Also, with the other vaccines that are being offered, please make sure that you are current with all of them and that you are following the guidelines of your physician. Know what your red flag is as far as your warning signs for lung infection. We are all used to waiting about a week to see if we're going to get better before we go to see our doctor. Anyone with a pulmonary diagnosis, it's very important that early intervention is the key. Call your doctor's office. Let them know, these are my symptoms. I've had them for about 24 to 48 hours. Last time I had this, I ended up in the hospital, or I ended up on steroids, or I ended up on antibiotic. What would you like me to do? The reason we recommend early intervention and letting them know how you responded to these symptoms is you are letting the doctor's office know that you are an active participant in your care. And again, that's what the folks that we're talking about with Anthem, that's what they were trying to encourage you to do. We live in a day and time that active participation in your health care is first and foremost. Christina and I, with our pulmonary rehab, are here to complement your efforts. But it is very important that you take the bull by the horns